Hi guys, welcome back to my channel. I'm Dr. Veena, a full-time NHS GP working in London, and today we're going to talk through how to tell if you have a sexual infection. At the end of this video, you should be able to identify some common signs and symptoms of sexual infections, and I'll talk you through what to do next if you think you may have one. Most sexual infections are asymptomatic, which means you will have no symptoms, no signs, you may be absolutely well, but you may still be carrying it or you may still have the bacteria or the virus on you. So what we normally advise is if you are sexually active, be it with a regular partner or new partners, get routine sexual health screens done at least once a year if you're with a regular partner, or if you have multiple partners, do a test every time you change partners. This is the best way to stay on top of it. Alongside being asymptomatic, some viruses and bacteria can also be latent in your body, which means you could have it and it could present with symptoms a couple of years later. So this is again a reason to why you should test quite regularly. The medium by which sexual infections are spread is from bodily fluids. This could be because of unprotected sexual intercourse, be it oral sex, penetrative vaginal sex, or anal sex. Some infections are also spread by sharing sex toys or not having specific hygiene while storing these toys and then using them again. Using condoms are the most effective way to protect against these sexual infections. However, you should also get regularly tested. For women, here are some of the signs and symptoms you may notice. If you are going to be symptomatic, you may get irregular bleeding. So this is not to do with your menstrual cycle bleeding. You may just bleed in between your cycle. You may bleed after sexual intercourse. You may get pain and discomfort in your pelvis. You may find an abnormal discharge from your vagina. This could be abnormal in the sense that it's very different to what you're used to. It may have a strong smell or odor. It may be completely different in terms of odor, but it could have a different color completely. You may also get some urinary symptoms such as burning or pain when you're passing urine, some blood or traces of blood which could make your urine appear pink, difficulty passing urine, or having to go more than normal and several times in a day. These are some of the common things that we see in women. So if you are worried about sexual infection and you're having any of these symptoms, please do get tested. In a man, sexual infections, again, majority have absolutely no symptoms, but some of them may get abnormal discharge from the penis. This could be thin, thick, it could have a color, it could have a smell. You may notice any rashes around your genital region. This could be with or without an itch. It could be blisters, it could be little polyps or growths, it could be broken areas of skin that's not healing. Men can also sometimes present with urinary problems, such as bleeding in the urine or pink stained urine. They may have pain while passing urine. These are symptoms to look out for. The most common infections that we see sexually transmitted in the UK are chlamydia, gonorrhea, herpes. If left untreated, they can have some serious consequences. For women, it can affect your fertility. It can give you more complex infections like pelvic inflammatory disease. So this isn't something you really want to sit on. If you have any of these symptoms or are worried that you don't have symptoms, but you've recently had a couple of partners and you just want to get your health under check, the good news is on the NHS, sexual health screening and testing is absolutely free. There are test centers all around the country where you can book to go in face to face, or you can write to them and they can send you a kit home. The kit would involve a swab that you have to get from the genital area and a finger prick blood test that you can even do at home and then send the kit back. The results will be sent to you via text. They're completely private, confidential. You are the only one who's going to get the results. And if you are positive for any infection, the clinic will also discuss contact tracing with you about how you can sensitively inform previous partners about your infection and what they can do to protect themselves. This is a sensitive topic. However, it does impact a lot of younger and older people. I say that because I have seen a lot of patients in their 40s who are nearing menopause who have stopped testing for sexual infections because they think it's a young person problem, but it isn't. If you are sexually active, you will be at risk of getting these infections. It doesn't matter about age, and that's why using protection, getting regular testing, and having an open narrative with your partners and discussing and talking about this is what we encourage. I hope this video helped to break down what the symptoms might be if you have a sexual infection and what you can do. Please leave your comments below. I'll do my best to answer them. It's important to also mention here that if you are tested positive, you will get treatment. Treatment in a lot of cases are a course of antibiotics, and a lot of these infections can easily be treated. So please, please, please do not sit on them and take action quite quickly if you have the symptoms. Thank you so much for listening. I'll see you in my next video.